welcome to this session. My name's Tara and I'm one of the trainers here at Exon Health. Today we're just going to spend about 30 minutes taking you through optimising practice performance with surgery insights. A little bit of housekeeping. Firstly, the call is being recorded today for sharing purposes. Secondly, any questions, please drop them into the Q&A box. The box is at the top of the Teams call. Do that at any point during the session, and I've got my colleague Dee who's on the call as well, and she'll endeavour to answer them. Lastly, as we go through the webinar, Dee will be dropping in relevant links into the chat box as we go through the session, so just watch out for those as well. So we're going to have a whistle-stop tour of Surgery Insights. We've got a lot to get through. It's a collection of dashboards for GP practices and PCNs, and it's designed to optimise patient access and streamline operations all in one place. So it provides and it combines publicly available NHS data with live telephony and digital assistant metrics from Exon Health and third-party suppliers. So it also will give you a month-by-month view to explore relationships between data sets, such as comparing inbound calls against online consultations. And it will also deliver regular updates on workforce, appointments and NHS app usage, typically reflecting the month-end position within 1 week of data availability. So the benefits. Now, the primary value of Surgery Insights is to help you move from reactive management to data-driven decision-making. It allows you to optimise workforce capacity by matching staffing levels directly to patient demand, which helps reduce missed calls, identifies where admin tasks can be shifted also to digital channels. Secondly, it also provides benchmarking against national standards. So you can compare your appointment volumes, your DNA rates and consultation trends against national averages to clearly identify performance gaps. And finally, it helps you measure digital product adoption. So you can quantify the tangible staff time gained and the number of calls deflected by using tools such as Surgery Assist, Omni Consultation, Surgery Intellect, and the NHS App. So ultimately, these reports give you the insight that you need to bridge performance gaps and maximise your team's efficiency. So, what can Surgery Insights show you? So we have said already, Surgery Insights acts as a central hub, and it consolidates your practice data into one unified dashboard, and it saves you from having to jump between different views to grab the data. It also allows you to monitor critical performance areas, so including operational demand, workforce capacity, digital adoption. And it also helps you access or assess patient satisfaction and experience, whilst providing clear benchmarks against the national standards. It brings demand, capacity and efficiency metrics into a single view, and the dashboard enables you to quickly identify areas for improvement and make data-driven decisions for your practice. Any changes that have been made, you can see where these strategies are clearly working well and making a difference through these dashboards. So being a central hub, Surgery Insights is an integrated system designed to grow alongside your practice. So whether you're using existing Exon Health tools like Omni Consultations or adding new features in the future, all your data will flow automatically into a single holistic view, including third-party data wherever access is granted. Okay, so how do we actually get to Surgery Insights? So if you are a Surgery Connect customer and you have purchased Surgery Insights, you can access the dashboard directly in the reports console via the phone bar or the single sign-on page. So that's a single sign-on page, and this is via the phone bar. and it keeps everything in one place and it's easy to use. So if you're not a Surgery Connect customer, it can be accessed via a direct link. Okay, so now we are going to have a look at it in more detail and walk you through some of the tabs. So firstly, I'm just going to point out that we will be going through all the tabs on the left-hand side here. You'll also see, I'm just going to go over to the actual report. There we go. So here we are in Surgery Insights. We're looking at live data for surgery. I've anonymised it as well for data protection. And we have got, first of all, we're looking at the welcome page, and it's really based on a lot of feedback that we've received from the initial rollout of Insights over the last couple of years, and really what practices want to see at the top level. So the page itself displays a high-level overview of your surgery's performance by benchmarking clinical KPIs against national averages, and provides a snapshot of patient satisfaction and digital engagement. So we'll just have a quick look through the actual tab itself. So if you can see at the top here, we have got your KPIs, which are compared and benchmarked to the national average. We've got red and green indicators. So the green means that obviously the rates and the percentages are matching or above the national average. The red indicates it's below, okay? We have got the chatbots here. Those will be displayed if you have Surgery Assist. And then we've got the NHS App, and this is for patients that are 13 plus. The national average being 75%, the benchmark, and here we've got 77%, so well above the national average. The monthly activity trends, this gives you the balance between phone calls, digital consultations, physical appointments, and you can also see as I move my mouse across, I get a snapshot of the exact statistics. And also here we can see online consultations was introduced. And then as I move along, you can see here we've got Surgery Intellect and has been introduced as well. And there we've got Omni responses. So you can see as you move along. Then bottom left, we've got the workforce full-time equivalent. So that tracks clinical and admin staffing levels alongside total patient registration trends. We've got your GP patient survey breakdown to gauge the overall satisfaction. And lastly, the percentage of patients registered to the practice. Okay, so that's your welcome screen. A lot of information to start with. Then we're going to go on to the activity summary. So this page serves as a comprehensive dashboard for your practice's digital transformation. It maps exactly how patients are accessing your services by combining data from all inbound channels. So, for example, if you introduce new technologies such as Surgery Assist, the dashboard indicates the go live date with a clear marker, and it will be a dotted line. So somewhere here, for example. And what you'd expect to see from that scenario is a shift in inbound phone traffic. So those are the orange bars. And you'll see calls naturally decrease and activity via the NHS app and online consultations increase. So this is due to Surgery Assist signposting to these and other relevant information and services. And it confirms that patients are effectively accessing care at their point of need and reducing the burden on your telephony lines. So let's just have a deeper look at the screen itself. So top left here, you will usually find the different views that are available. So you can view your staffing levels and you've got a granular table view as well. Then top right hand corner here, you'll find all your national benchmarking. So again, we've got the green and red indicators, appointments per 1,000 patients, etc. Then we have the visual on the workload by breaking down the volume of requests via phone call, which is the orange bar, the online forms, which is the online consultations here, the chatbot and the NHS app. So you can see they're all broken down. Now, if I just click on one bar, let me just refresh, and we'll go back. So we're on activity summary. Okay. Yeah, so at the moment, because I've had to refresh, I'm looking at multiple surgeries. So we're not just looking at one surgery at the moment. It's just to cut down time for this webinar. So where did we get to? So you've got your benchmarking up here, and we've got the workload by inbound calls, online consultations, and using the NHS app, appointment and prescription activity. And again, if you click on one bar, it will recalculate the national benchmarking. Okay, so here we're just hitting the national average. Click again, and it will take it back to the original data set. Okay. Now we are going to jump on to the telephony report. So what we have here, it provides a detailed breakdown of how your practice handles phone traffic. It's essential for identifying pain points and understanding how patients navigate the automated menu. It's also available for your standard telephony. It's designed to give you total visibility over your inbound call traffic, whether you're using automated tools or the standard telephony. The dashboard is going to provide you with high-level picture of your practice's busiest times, wait durations, and the reasons patients are calling. So again, we've got the different views at the top that you can select. You've got your benchmarking here against the national average. You've got your red and green indicators, and then you've got your 4 panels here. So these are the inbound calls, and it tracks the call attempts, and it categorizes them by queues, abandoned and missed. So we have got here abandoned, queued missed, queued answered. Okay, and also what you'll find in all the visuals is there's 3 small icons at the top here. We've got here, you can change the filters, the date, etc. Here you can focus on a particular visual. I'll just go back to the report. And here you've got other options, so you can export data. So you'll find those 3 options here at the top of all your visuals. You've got your callback success rate measured. And again, as I move the mouse across, you can see I've got individual statistics for that particular month, for example. And again, your wait to call and call duration times, and then the menu choices. This is a really interesting one because it gives you an immediate feel for your appointments choice being the most popular, and then general inquiries next. Okay, so maybe you can do something with the staffing for particular options. And this is where your customization comes in for call flows, etc., and groups. So then we're going to move on to appointments. Now, this offers you a detailed analysis of clinical workload by benchmarking your surgery's performance against national NHS standards. So it's looking at key metrics such as appointment attendance trends, so DNAs, appointment-led times, and the balance of care between GPs and the wider clinical team. So what we do is we pull your appointment data directly from your clinical system, such as EMIS or System 1, and provide a comprehensive view of your practice's activity. So The goal is to move from simply tracking volume to gaining a deeper understanding of what your appointment slots represent, enabling better management of clinical time. So again, we've got the different view options here. We've got your benchmarking across the top here. And again, we've got a visual that gives you exactly where clinical time is spent from triage and routine care to acute consultations. And then the number of missed appointments over time, and also the number of appointments and the balance of care between doctors and the wider team like nurses and pharmacists. So now we're going to jump onto the NHS app. And this is a dashboard that sort of shows you an overview of how your patients are interacting with the NHS app. The report's split into 5 key areas, accessible via the navigation buttons at the top here. So we've got uptake, usage, messaging, jump-offs, and data table. So over here, we've got the display of the latest month's registration rate compared to the national average, okay? And then we have got the registered patients versus the target. So again, the target's 75%, but because we've got multiple surgeries here, it's giving us an average, so it is slightly below, okay? And then we've got the tracking patient engagement with national health initiatives, so including lookups and updates. So this particular one is looking at organ donation. And then at the top here, it's just giving you a volume of new app registrations alongside the overall percentage of the patient list. Okay. So now we're going to go on to some of the paid for products. So the first one we'll look at is Surgery Assist. This will only show if you are using the product. Surgery Assist is our NHS approved digital assistant. It's designed to signpost and educate patients towards appropriate healthcare and community services. And it reduces the demand on GP surgeries and increasing the usage of NHS App and online consultation tools. It's a great product and it's got brilliant data backing it up. If you don't already have Surgery Assist, we can drop an interest form into the chat, which Dee, I think, has probably done just now, and we'll get in touch with you about it. So let's just have a little bit of a closer look at the actual tab. So we've got the timing tab here, provides you a closer look at the volume of chats by days and hours, and the AI questions. It gives you detailed information on every question that's asked via the AI chatbot. Then we have these statistics here, which measures the total volume of conversations and the number of saved calls because of those conversations. So where patients have used Surgery Assist instead of calling into the surgery, okay? Then we've got heat maps here, and again, you can move the mouse across and you'll see individual statistics, and it helps identify busiest days, hours, specifically identifying out of hours usage. And then on the left hand side here, you've got the top reasons patients are using Surgery Assist. Okay, so here we've got appointments is at the top, and then again, interestingly enough, the AI input, the user input is I want to book an appointment. Okay, so that tells a story in itself, that there's still a lot of patients out there interested in those appointment bookings. Okay, we're going to move on to Surgery Intellect. Now, Surgery Intellect, powered by Tortoise, is our voice-enabled AI assistant that uses ambient voice technology to listen, transcribe and code consultations in real time via the phone bar. And this is with telephone and face-to-face consultations. So again, this will be only visible if you're using the feature. It will also appear automatically in the reports portal if you're using it as well. And again, if you don't yet have Surgery Intellect installed, you can register your interest via the link, and Dee will pop that in. And also, we'll be happy to talk to you. There is currently a free 3-month trial available at the moment as well. So let's just have a quick look around the screen. So with the data table here, we've got the visuals. And then we've got the data table. It gives you that information in more detail. Here we have got the display of volume of outputs from the scribe. So Intellect, clinical notes, medical codes, etc. Here we've got the estimated time that's been saved. Now this is based on 15% of the audio duration. Okay, so this is total across all surgeries that have Surgery Intellect. We've then got the Intellects by month, and this is the staff usage over time. So you can see how it's growing month by month. And then we've got the tracking generation of specific clinical outputs. So that can be letters, medical codes, and transcriptions generated. Okay. A lot of information, again, to take with you. So let's go on to the Omni Consultation. Now, Omni Consultation forms allow patients to submit medical requests directly to your practice. This information is then compiled into responses, allowing your staff to easily manage the triage workflow. The consultation form data can be gathered through a voice agent, a web form, or manual entry by staff, and that's over the phone or face-to-face. Again, it's only visible if you're using the feature, and it will also appear automatically in your reports console. Also, if you don't have Omni Consultations yet and you'd like to know more about it, you can, we'll have a link in the chat where we'll get back in touch with you and have a chat. We've also got a case study from the Alexander House Surgery if you're interested to have a look at that, and that link will be dropped into the chat box as well. So at the top, we've got a high level breakdown of how patients are reaching the surgery. So we can see here that we've got the phone bar and voice. Okay, so that is a really good immediate visual. We've then got the raw data here. That's a numerical count for each consultation channel. And then the estimated time of clinical staff time being saved. And that's based on 2 minutes per consultation. Here it shows you the consultation, the volumes, so you can track seasonal trends or growth by month. And then we have here, it tracks if the appointment's booked for themselves, patients, or on behalf of someone else, say a child. And then we have the severity and the priority of consultations and categorizing here. So you can see at a glance in the table view. Now we're going to go on to online consultations. I'm going to jump down here. So this report tracks the volume and type of online submissions received by your practice, either via our Omni online consultation form or a third-party service. It also displays the resolution pathways of the online requests and helps you understand signposting and workflow effectiveness. Now, you've got the different views again at the top. You have a total number of online requests and how your surgery's volume compares to the national average. The bar chart shows the total volume of the digital requests received each month. Again, you can click on the bar and get detailed statistics for that particular month, online consultations per 1,000 patients, and then the percentage split between the requests for clinical, administrative categories. So we've got admin, clinical, and other. So we can see the majority is for clinical. Next, we are going to have a look at operational efficiency. Now, this tab provides a data-driven look at how digital tools are reducing the admin burden on your team. If the other reports are magnifying glasses and looking at specific tools, the operational efficiency tab is your wide-angle lens. So it's where we bring everything together, all of the products that you use, and it calculates the cumulative impact across the entire product. Okay. Now, ultimately, this tab is about quantifying the relief provided to your team. It allows you to see the impact of your digital transformation, moving from managing tasks to managing clinical outcomes. Okay, so here we've got where the chatbot Surgery Assist has been most effective, and shows the days and time saved by Surgery Assist for the admin staff. Then here we've got the summaries of the overall impact, showing the total minutes and days that have been saved. We've got hours saved by day, so Assist, Intellect, Omni Consultation, and you can see also on a Saturday and a Sunday, we've still got hours that have been saved. So even when you're not open. And then we've got the hours saved by month, so you can track the impact over time on your patients using the digital tools. Okay, so it's a really powerful tab, that, the operational efficiency. We've then got the workforce and patients tab. Here you can see, let me just pull that up. You've got your different views at the top. You've also got your different, your benchmarking as well. And then we've got the 4 visuals. And again, you've got your 3 icons at the top so that you can filter and focus, etc. And then you've got your bar charts. So you've got your workforce full-time equivalent. So that's admin, clinical nurses, and then you've got them in table format, and your workforce headcount, so admin, clinical, and nurses. So that's different to your full-time equivalent. So this would be part-time staff as well. And again, you've got the table equivalent there, giving you that breakdown and percentages. Now we're going to have a look at the GP patient survey. So this is the newest tab we've made available and delivers direct annual feedback from your patients regarding their experience of access and the quality of care received. So we'll just have a quick look. You've got, again, the different views at the top. You can make yearly comparisons in the view in the data table. We've also got a snapshot of the overall GP experience and ease of contact. Then we've got the quality of patient experience across the different channels. Okay, and it's all color coded. We've got here where patients have attempted to contact the surgery and the outcome of those attempts. And then the pharmacy, also we've got data on there as well. Let's go through to the resources tab. So finally, we've got the resources tab, and this shows you where all the data comes from if you're interested. We have got at the top, this is where you've got quick access to technical support and deeper documentation for all the Exon Health services. This shows you the freshness of the data being viewed, when it was last updated, And this is the audit trail of every metric back to its origin. So it will tell you here where it's come from. Okay, digital, NHS Digital, Exxon Health, Intellect, etc. Okay. Then lastly, we've got filters. So if you did want to change the filter, the date range, etc., then you could do it via that particular tab. So I'm just going to go back onto my slides. This is a quote from a customer because we've been hearing some great feedback and they've got stuck into the data and really analysed it. So I'll just give you a couple of seconds to read that, and then we will have a couple more slides and then we're done. Okay, so just to finish on, we've got our new academy that was launched at the beginning of June. It's especially, we've got the Surgery Insights course on there to complement everything that I've gone through today. We've got the Academy link and the specifics to the Surgery Insights Academy courses. They'll be dropped into the chat box as well. And then for additional support and resources, we have got lots of help centre guides here. And if you wanted any more information on anything that we've covered today, you can email your customer success advisor, or you can use the training email as well. And if you'd like to know more about Surgery Insights, you can contact us and register your interest with the link that will be dropped in the chat to contact us. Okay, so thank you for your time today. We do have 3 more webinars over the next 3 weeks. Also, if you want a deep dive into any particular area, I do appreciate that it was a whistle-stop tour. Get in touch with your CSA and look out for the follow-up email, which will include the recording. Thank you very much again, and goodbye.